My name is Scott Widener from Maryville University. This is my Nursing 612 head-to-toe video. This is my volunteer, TC. Before I brought TC back to the room, we had him empty his bladder, change into a gown. We did a full set of vitals including height, weight, and BMI. We did a distance vision screening with the Snellen chart and a near vision screening with the Rosenwald chart. This helped assess cranial nerve number 2. As he walked into the room, I watched his balance and his gait. His gait and balance were adequate. I also asked multiple questions to assess for alertness and orientation. He was alert and oriented, asking and answering questions appropriately. I provided for comfort and for privacy. Are you comfortable?
Yes.
I've washed my hands and now it's time to begin the exam. Looking at the exam initially, I'm looking at the skin color, looking at for masses, lesions, scars, imperfections. I'm looking at the pattern of the color of the skin. I'm also looking at the hair distribution over the skin. I'm also going to be looking at the temperature and skin turgor. Those were adequate. I'm going to continue assessing skin throughout the exam. I'm going to begin at the top of his head, looking at his scalp. As you'll notice, he has removed his male pattern baldness with a razor. So I'm looking to make sure he has no injuries related to that. Also, again, looking at the skin for masses, lesions, change in color pattern. And now I'm going to move on to palpation. I'm assessing for the scalp to move easily over the skull, looking for masses, deformities, which I felt none. Did you have any tenderness? I'm now going to move to his face. The head was overall normocephalic. Symmetry between side to side is maintained. I'm looking at the skin of the face, looking again for lesions, masses, or injury. I'm going to now palpate his facial bones, moving systematically up and out and around the mouth. Open up and close. Good. Did you have any tenderness? I did not feel any clicks or pops at the TMJ location. I'm now going to start with light sensation, and I'm going to have you close your eyes. Tell me if you feel dull or sharp.
Dull. Sharp. Dull. Sharp.
Good. You can go ahead and open your eyes. I'm now going to go and continue with the cranial nerve assessment by having him wrinkle your forehead. Scrunch your eyes open high and lift your eyebrows. Good. Smile. Frown. Puff out your cheeks. Stick your tongue out and wiggle it side to side. Good. You can relax. That helps me assess cranial nerves 5, 7, and 12. Now that I've done that, I'm going to move on to his ears. Again, always with inspection. Looking at the auricles. Making sure they're symmetrical. Looking at the top of the auricles in reference to the outer campus of the eye. And they're at eye level, not below. I'm looking for any skin abnormalities as I do my inspection. Now that I've moved on, I'm going to move on to palpation, pulling gently on the earlobes. Any tenderness?
No.
I did not feel any masses or other deformities in the auricles. I'm now going to use my otoscope with the largest speculum I can use to fit in the ear without causing discomfort and still visualize. Pulling the pinna up and back, inserting 1 to 1.5 centimeters, looking at the external and middle ear, looking at external canal and middle ear. The external canal, I do not see any foreign bodies. It's pink. There is minimal cerumen and there is no erythema. The middle ear, his tympanic membrane was pearly gray, translucent, with no bulges or perforations. Now I'm going to move to the whisper test. The whisper test, I'm going to stand behind him, have him lift his hand to his ear. I'm going to repeat a word, say a word and have him repeat it.
Squirrel.
And
Squirrel.
good. Now I'm going to move on to the tuning fork exams. Starting with Weber, which is the top of the head. What I want you to do is just let me know if you hear this equally or on one side better than the other.
Equal.
Good. Now I'm going to test bone conduction versus air conduction bilaterally. Lift your arm up when you stop hearing this. Good. And now we're going to move and do the same thing on the opposite side. Good. Bone conduction should be approximately double that of air, or excuse me, air conduction should be double what bone conduction should be. Now, I'm going to move to the eyes. Again, looking for symmetry, also noting the shape and color of the eyebrow hair. Noticing that his left eyebrow is inset and a little lower than the right. I'm looking at the eyelids, looking at the eyelashes. They grow out and up. There is no periorbital edema. I'm going to pull down on his sclera to look at his sclera. I do not. His sclera is pink and moist. His conjuncta is white without jaundice or some conjunctival hemorrhages. I'm now going to look and see. I don't see any dryness or excess tearing. I'm now going to palpate the eye. You close your eye. I'm going to gently palpate your eye and your lacrimal apparatus. Any tenderness?
No.
Now that I've done that, I'm going to use my otoscope as my light source to check pupil reaction. So if you would just hold still, I'm shining my light to look for the direct pupil reaction and the consensual reaction on the opposite side. Direct and consensual. And his pupils are equal and reactive to light. I'm now going to do the 6 cardinal gazes with him. Have you stare at the light, and I'm going to move it in an H pattern, and I just want you to track the light. Hold your head still. Good. Looking for extraocular movements, and then I'm also testing for accommodation. So, cranial nerves 3, 4, and 6 are grossly intact. I'm now going to have him do the cover-uncover test. So go ahead and cover one eye as you look at a distant object and watching the pupil react. Go ahead and do it the opposite way. The pupil should constrict when covered and dilate when he uncovers it, focusing. Now we're going to do the confrontation test. Go ahead and cover your left eye. Tell me when you see my finger.
No.
Good. And the other.
No. No.
Good. And relax. So I've done the eye, and now I'm moving into the nose. With the nose, again, I'm looking for symmetry of the nose. Looking at the septal for any deviation. I don't see any. Looking again at the skin. Always looking at the skin when we inspect. Now I'm going to look with my light. Look at his turbinates. Looking to see if his mucosa is pink and moist. His septum is intact. The turbinates are without erythema. I'm now going to have palpate his nose and his sinuses, seeing if he has any tenderness.
No.
No tenderness. And have you close one nostril, breathe in and out. And the other one. And did you smell anything?
Coffee.
That was testing cranial nerve 1. Now we're going to move down to the mouth. And the mouth has a lot of assessments in it. So as I open his mouth with my tongue depressor, looking at his gums, his teeth, his tongue, stick your tongue to the roof of your mouth, wiggle side to side, good. Looking at the hard and soft palate and a gag reflex. I'm assessing his teeth, a 28 teeth, ivory in color, no bad breath. The multiple repairs are intact. Mucosa was pink. There was no cracks or lesions on his tongue, and his uvula moved up and down in midline and not deviated. I'm now going to move down and start palpating for lymph nodes. I'm going to start at the back using fingers 2, 3, and 4, starting with the occipital, postocular, preocular, tonsillar, submandibular, submental, anterior cervical, post-cervical, deep cervical, and supraclavicular. Did I elicit any tenderness?
No.
And I did not feel any enlargement. So now that I've done that, I'm going to now look at his neck. Notice how he's holding his head erect without any nodding or tics. I'm also going to note the skin, the pattern of the skin. There's no loose skin flaps. There's no extra pulsations. Trachea is midline. Thyroid looks to be not enlarged. I'm going to now palpate the trachea, filling the tracheal rings, assessing for any tracheal tug. Also going to palpate one carotid artery, and then the next, avoiding reducing any cerebral flow, blood flow. Good. I'm going to now do some passive ROM. So I'm going to have you look left, right, good. Up, down, good. And we can't tell our left from right, so that's okay. Going to have you put your ear to one shoulder and the other, good. Going to put my hand, now press against my hand, and the opposite way. Good. Shrug your shoulders, don't let me put them down. Good, and relax. That helps me assess cranial laryngeal number 12. I'm now going to go behind my patient to assess the thyroid with palpation. I've inspected and now I'm going to palpate. So I find the Adam's apple, find the cricocartilage just below it, and I'm going to have him swallow. I don't feel any swelling or abnormal movements of his swallow. Now pushing to the left, feeling the lobes of the thyroid with my left hand. Again to the right, feeling with my right fingers, and I do not feel any nodules. The next step for the thyroids and the carotids is to listen. In order to do that, I'm going to have you turn that way and hold your breath. And this way. Good. And forward and hold your breath again. Good. And you can breathe. I do not hear any carotid or thyroid bruits. Now, I'm going to move down to his anterior chest. Looking at the scan again, hair pattern, the color pattern, side to side, looking for symmetry, looking for equal chest rise and fall, and any signs of respiratory distress. I do not see any. I'm now going to palpate the chest, making sure that I palpate along the rib cages, laterally, and both sides, and I'm going to go ahead and assess his axillary lymph nodes. Any tenderness?
No.
Good. Now that I've done that, it's time to percuss. But before that, I want to make sure, when I palpated, you always want to make sure you look at the pericardial area, looking for thrills or heaves, and any abnormal pulsations at the apical pulse. So now, I'm going to go ahead and percuss, and you just want to do it in a systematic way, learning how you like to do it, and you're listening for resonance, trying to elicit any dull response, and I don't feel any. Next, I'm going to have him do tactile primitus. Read 99.
99, 99, 99.
Good, and you can relax. So now, I've done percussion and palpation, including tactile primitus, and it was equal. I did not hear any dullness with percussion. So now I'm going to move to listening. And I'm going to listen for lung sounds. Should hear vascular sounds. Deep breath, open your mouth open. Listening for any abnormal buzz sounds that would include wheezes, crackles, and rhonchi. Comparing side to side. Now I'm going to listen at the aortic, pulmonic valves, Erb's point, tricuspid valve, and mitral valve. And I hear S1, S2, no additional heart sounds, and no murmurs or gallops. So now I'm going to move to the posterior chest. So with the posterior chest, I'm looking at, as I come around, I'm looking at his AP diameter for barrel chest, and I do not see any. His are approximately 1 to 1. I'm now going to look at the overall back, again looking at the skin color, hair distribution, making sure it's symmetrical, bone structure, or muscle structure and bone structure are all symmetrical. Once I've done that, I'm going to palpate not only the posterior chest, lateral chest, but I'm also going to come down the cervical and spinal column. Did you have any tenderness?
No.
Now, I'm going to do tactile primitus. Say 99 repeatedly.
99, 99, 99, 99,
And relax. Tactile primitus was equal bilaterally. Now I'm going to percuss. Percussion, we just move in a systematic way. Again, listening for resonance and dullness as we go. Now that I've done that, what I'm going to do is look for thoracic expansion and diaphragmatic excursion. For thoracic expansion, I'm going to put my thumbs on the side of the spine and have him take some deep breaths about rib 10, and that is equal. Now I'm going to move to the mid-scapular line, have him hold his breath, and I'm going to tap down until I hear dullness, marking this area, breathe, and then I'm going to move up until I hear resonance, marking that spot. Move to the other side and do the same. Hold your breath, and dullness, go ahead and breathe, move up, and resonance. Those distances are equal, about 4 centimeters, and the right side is slightly elevated due to the liver, which is normal. Now that I've done that, it's time to listen to his lungs. Again, we're listening for vascular sounds. Go ahead and breathe normal with your mouth open. Comparing side to side. Listening for abnormal wheezes, crackles, or rhonchi. Again, making sure we listen to the lateral aspects of his chest, just as we percussed and palpated. Go ahead and relax. Now that we've done that, we're going ahead and have him roll to his back. Again, starting the abdominal assessment with inspection, looking at the scan for any masses, lesions, trauma. We're also looking for any extra pulsations or bulges. I don't see any, but I'm going to check the contour for any more. Contour is flat, and I don't see any masses or protrusions or extra pulsations. I'm going to listen to bowel tones in each quadrant for up to a minute. Once I hear bowel tones, you move along, spending up to a minute on each quadrant, no more than 5 minutes for assessment. Now I'm going to listen to the aorta, the renal arteries, iliac arteries, femoral arteries, and I do not hear any abdominal bruits as I did that. Now I'm going to move to light palpation. Using my hand in a circular motion, I'm asking him if you have any tenderness, watching to see if he has any tenderness, trying to feel any bulges, masses, or extra pulsations, and I don't feel any. Midline, just above the umbilicus to the left, attempt to find the abdominal aorta, feel the pulsation. If you feel a bulging pulsation, try to find which way it goes. In thinner people, you might be able to use your thumb and index finger and actually capture the aorta. Now I'm going to percuss. I'm going to do deep palpation. Deep palpation, same circular motion, continue to look at the patient and ask if he has any tenderness. You're also going to pay particular attention if you found any tenderness or if you found a mass in your light palpation. Now I'm going to percuss. Again, this is just like the chest, systematically finding your own way of percussing, listening for tympany, which is normal. Any dullness would be an indication for further investigation. Now that I've done that, we're going to measure the liver borders, and we're going to find the border of the spleen. In order to do this, I'm going to put my hand on his abdomen, percuss from tympany to dullness up the ribs, which is right there. Going to come down from resonance to dullness, which is right there. This is about 10 centimeters, which is normal between 6 and 12. Remembering this spot, I'm going to come over here, the same to the spleen, and pulsate or percuss until I hear dullness, and then come down from the ribs, more on the mid-axillary line, until I feel dullness to find the borders of the spleen. Now that I have this area marked for the border of the liver, I can try to palpate the liver. In order to do that, I'm going to reach around, lift up, have him take a deep breath, and try to find it. I'm unable to find it, which is a normal variant. Now do the same with the spleen, and I was unable to find it either, which is, like I said, is a normal variant. Now with the kidneys, you do the same thing, pressing down, pulling up, and as he lets go of his breath, you're attempting to feel the lobes of the kidneys run through your hand, and I don't feel them. Good. Check his femoral pulse. Again, checking for regularity and pulse pressure. As with his carotids, they are both equal bilaterally with a pulse pressure of 2. Now we're going to move to extremities. Upper extremities, we're looking at the overall skin and muscle tone, which is symmetrical. We're now going to palpate for any tenderness, including palpating the PIP and the DIP joints for any nodules, looking at the fingers for clubbing as we're doing this, coming down the arm, feeling on the bony aspects to find any masses or deformity, and I don't feel any tenderness in the hands or any question palpation. Good. If you'll put your hand on your stomach, I'm going to test your radials. Radial pulses are regular, bilaterally, 2 plus in strength. Now the brachials. Again, regular, 2 plus. Now that I've done the upper, I'm now going to do the lower. Again, looking for symmetry of the muscle tone, skin color, hair distribution, which is normal on my volunteer. I'm going to now palpate both the anterior, posterior aspects of his legs, making sure to pay particular attention in the shin area for edema, and also any bony areas I can feel for any bone masses or deformity, and I don't find any. I'm now going to palpate for pedial pulses. It's top of the foot for the dorsalis pedis, post-tibular, and the popliteal. Those are all intact, equal bilaterally, 2 plus in strength. Go ahead and push down with your foot and pull back. Push down and pull back. Good, and relax. Now if you put your hands in front of you, push and pull. Good, you go ahead and sit up. Muscle tone was equal bilaterally with strength of 5-5. Now we're going to move to reflexes. First is the bicep reflex. Find the bicep tendon, use your hammer with your fingers, strike your fingers and watch for the bicep to react. Compare side to side with an equal reaction which I received. Now the radial nerve, just about 2 centimeters up from the wrist, strike with the hammer, you're looking for the thumb to react. Make sure you compare this on both sides and see if you get an equal reaction, which I did. Now we're going to move to the knee papilla. So just below the patella, we're going to strike the hammer and elicit the tendon reflex, which I was able to do. Giving a little dorsal flex, not so much, there we go. Elicit an Achilles tendon reflex, relax, and there. All deep tendon reflexes are intact. We're now going to have him stand. I'm going to have you bend over and pause, looking at the curvature of his spine. I see no kyphosis. Go ahead and bend past neutral and relax. Any pain with that?
No.
Now I'm going to have you bend side to side and go ahead and sit down. Any tenderness with any of those movements?
No.
ROM is intact. Thus ends my head to toe video for Nursing 612. Thank you.